Hi, I'm Nick Brown, pain specialist physiotherapist, and welcome to my YouTube channel. This is the first video in our Focus on Back Pain series, and we're going to explore the causes of back pain, why it's rarely a sign of serious damage, and discuss some common myths. Remember, this video is for general information only and is not intended as individual medical advice. So back pain is actually extremely common, and around 80% of us will experience it at some point in our lives. But despite how common that it is, there is still a lot of confusion and outdated beliefs around the causes and how to manage it. So the first thing to say that back pain is actually quite complex, and it's influenced by many factors, not just the structures actually in your back. It's also very difficult to be really specific about an exact cause for the pain, and it's not always really even related to tissue damage. So physiotherapists will often pick up things like stiffness, weakness, muscle spasm or tenderness to touch, but we don't know the exact impact that each of these things has. So these things obviously can contribute, but modern pain science tells us that back pain is also affected by a range of other factors, such as stress, poor sleep, low mood, whether you smoke or drink excessive alcohol, the foods that we eat, or fear of pain, which leads to an avoidance of movement. And this is because pain is like an alarm system. It's there to protect us and promote healing. So it doesn't just respond to physical injury, but to anything the body perceives as a threat. And these things can all feed into the pain that you experience. Let's go through some common myths. So some of these that you may already have heard. So firstly, that I need a scan or strong medication. Scans usually show normal age-related changes that don't correlate well with pain. I see many people with severe back pain and normal-looking scans, which can be hard to accept, but remember that pain is more than something that can be just captured in a static picture. So I'm not saying that no one ever needs a scan, but reassuringly, actually most people with back pain don't. The medication, it may help some people during a flare-up, but in the long term, the side effects can be difficult to manage, and they may become less effective over time. Secondly, that bending and lifting is bad for me. Well, actually your spine is inherently strong, and we know now that gentle movement and gradual exposure to doing more over time, including lifting and bending, are better than avoiding activity, which is what we used to say. So many years ago it was all back braces and bed rest, and we've moved a long way since then, thankfully. 3, that you should rest and stay in bed. We tend to say maybe for a day if you really can't move, but after that resting too much can make things worse. So movement really is medicine. 4, I must sit up straight and brace my core. There's no perfect posture, and actually being too tense can actually really make the pain worse. A lot of muscle spasm and tension and guarding develops. Your body thrives on variety and movement, and I would aim for more relaxed, easy movements in the long term. The worse the pain, the worse the damage. As I said before, pain does not directly equal tissue damage, and even severe pain can come from a really sensitised nervous system. So when should you seek help? I think anyone struggling with pain should reach out to a trusted health professional for support, assessment and guidance. Now, there are obviously times, which are thankfully rare, when back pain can be a sign of something more serious. So if you experience severe pain with fever or sweats, unexplained weight loss, loss of bladder or bowel control, numbness in the area where you wipe yourself when you go to toilets, or you've had significant trauma like a fall or some kind of accident, then please seek medical assessment immediately. So the good news is that most back pain improves with the right approach, and even for more persistent pain there are still lots of things that can be done to help. So we'll go through these a little bit more in our next video. Thanks for listening today. Remember to subscribe to the page to keep up to date with the latest releases, and share with someone that you think needs to hear this today. Bye for now.